Ever wish that you could fit into skinny jeans or just feel really good about the clothes you're wearing? Well, a lot of people are choosing something called Smartlipo, and we are here with Dr. Scott Carlson of Carlson Laser Aesthetics. And I know that you have a lot of people come in and ask you questions about Smartlipo. What exactly is it?
It's a new technique. It's been available for about 3 years, and what we do is we actually use a little laser probe to melt the fat under the skin, and then we use a very tiny catheter to suction it out. And we do it while the patient's awake, using local anesthesia. We call it tumescence anesthesia, and the patient really experiences no pain at all during the procedure.
The first step is a consultation, and a person would speak with an esthetician and then speak with yourself, right?
That's right. Like Kathleen here today. She came in. She was concerned about this belly that she had. She's exercised, worked out, watched her diet, but she couldn't get rid of her abs and a little bit of flank area that was a little full. She wanted to be able to fit into her clothes, feel comfortable in them, be able to go out shopping and buy clothes that fit well for her.
So after that first consultation, in talking with you and with Allie, there's another visit, a second visit. What happens then?
That's called the Preoperative Evaluation. She comes in, we'll do her blood test and make sure that she doesn't have any blood clotting disorders, and we're going to just examine her and make sure she's healthy for the procedure. We don't want to have anybody do an elective procedure if they're not well or feeling great.
Then after that, a third visit to your office, and that's actually procedure day.
That's procedure day.
Let's walk through that.
Well, first we bring the patient into the operative room, and the first thing we do is we look at the abdomen and we actually draw lines on the area that we're going to treat. We call them treatment areas. And we'll do a series of lines, and we kind of highlight the high points and the contours that are high. And then we lay them down, and we're going to do some measurements on them. And we do some numbing. We make about 6 little ports after we numb them up. And those ports are little openings, about 3 millimeter slits. And then once that's done, we put a little catheter in those ports, put in some fluid, and that fluid numbs up their abdomen. We let them sit for about 20 minutes to half an hour. When we walk in, we can start lasering, and they don't feel a thing. They're totally awake the whole time.
That is amazing, and thanks to you and to Kathleen, we're able to document this so people can actually see what's happening and be a part of the procedure. I did talk to Kathleen about it, and she said she was feeling no pain at all.
She felt wonderful. The only time she felt a little discomfort is when we numbed up those little pinholes that we made. We had to numb those up first with a little needle poke and xylocaine. She felt a little discomfort there. After that, it was a home run.
And you could literally see the fat coming out of her body. That I found amazing.
That last stage, after we've lasered all that fat, it turns into like a slurry, and we're able to introduce a very small catheter, 3 millimeters in diameter, and we're able to suction all that fluid out of there. And it's perfectly painless. She had no discomfort at all.
So we've learned a little bit about Smartlipo. I'm curious of what makes Smartlipo different than traditional liposuction.
Well, traditional liposuction, everybody knows about that, and there's been some dangers with it. One of the things is you have to be put to sleep with a general anesthesia. So it's a painful procedure. They use a larger bore catheter. I mean, it was bigger than an ink pen. And you would go in there and suction out a lot of tissue, and sometimes you suctioned out some blood vessels and nerve tissue, and you would get some bleeding, extensive bleeding. The bruising would be extensive for 6 to 8 weeks sometimes. This procedure we did today on Kathleen, she might have a little bruising at a couple of the openings. It'll be gone by next week.
Wow, amazing. So she leaves the office the day of the procedure, but there's follow-up to make sure that she's doing okay and has the right healing and expectations that have been met.
We'll see her at the 1 week time, and at that point, she'll have no draining. She won't be bleeding. Like I said, the bruises will be nearly healed and gone, and she'll already be noticing about an inch or so reduction in her waist and her hips.
Wow. Well, I could even see the change to the eye as you were doing the procedure.
Wow, she was laying on the table.
Yeah, it's amazing, just, the difference. And she could see it as well, and she was pretty pleased.
She was excited. She was
very exciting. So the first step, a consultation with the folks here at Carlson Laser Aesthetics. We're talking about Smartlipo. Check it out.
And really, what an amazing opportunity to be able to see this procedure, especially if you are seriously thinking about having Smartlipo done. Dr. Carlson removed more than 1 liter of fat from Kathleen's body. You think about a 2 liter of pop, which is very familiar to
It looked
people.
like kind of a lot.
About half of that 2 liter. And as you could see, she was awake during the procedure, experiencing no pain.
And you were there the whole time, too. And Kathleen will have 4 follow-up appointments after the procedure just to make sure that she's healing okay and she's happy with the results.
Yeah, Dr. Carlson is offering a very generous special for 8 West viewers. If you call today, you can purchase Smartlipo for 1 area, and you'll get the second area half off.
All right, so give Carlson Laser Aesthetics a call to see how they can help you. The office is easy to find. They're located at 1525. That's on the East Beltline in Grand Rapids. And their number is area code 616-363-3640.
Right, so you just have to call today to make that consultation.
Right, so make